I was treated at Providence for a stroke that occurred during jiu-jitsu practice and sparring that happened to me. And that was in November 2020. This was during COVID. I had a training partner that I'd been training with for about a year. Something had shocked him, and he called the black belt over and says, "Oh, the guy's having a stroke." They called 911 right away, and I was kind of numb at the time. I remember the paramedics coming in and putting me on a gurney, and then I was kind of a blur after that.
Patients with stroke symptoms, they should be treated as soon as possible. So every minute, brain is losing 1.9 million cells without blood supply.
You know, I think patients always tell me what excellent care they received.
They took good care of me. They took me right to Providence that had a stroke unit all set up that they could perform what needed to be done to me to relieve the blockage from my brain so quickly before any permanent damage could be happening to my brain.
I think stroke care has changed over the years. Now emphasis is more on not just the acute treatment of stroke, but also continuum of care.
It's a really good relationship to work with the providers like Dr. Kansara, because he sees the patient in the acute setting, and then I connect with them and talk about the follow-up plan.
When I was younger, my father had 2 full open heart surgeries. I don't want to be like that. The lifestyle and stuff like that was really kind of damaging his life and expectancy. He died at age 68. I've always wanted to be active and always enjoyed being active.
It's what we talk about secondary prevention, right? So we're in the realm of once patients have had a stroke, then how do we prevent them from having another one?
So some of the challenges for us in the past was follow-up care. So let's say that with advancement of treatment, acute treatment, we are able to provide thrombolysis for stroke patients. But then follow-up care was lagging.
You know, Providence is very innovative in terms of our telestroke network. We have a large network around the state.
With advances in telemedicine and telestroke care, now we are able to reach back to the patient in their community. We provide telestroke services to 100 hospitals. So at a time, we had 2 physicians on call covering this many hospitals.
We're also able to take that into the outpatient setting. Now we were able to do virtual follow-ups with patients in their homes, and that has been a real change in our practice.
So last year, we provided care for more than 10,000 patients. So we took more than 10,000 calls.
One of the things is knowing that you're being there, basically feeling safe that you're being taken care of. And one of the things that also helped was to help my family feel safe. They were very communicative with my wife and my kids.
Compassionate care for us means you are providing care to patients and family like they are your own.
Just knowing that I can make a difference in patients' lives is very satisfying to me and have an impact on their life and their family going forward.
And that brings the sense of community, and when patients sees that continuum of care, they really appreciate those services available at Providence.
There are people who have gone through this situation who are a lot less fortunate than me and have not been able to recover, who have had permanent brain damage. It's a hard lesson, but I'm grateful that Providence was there to be able to help perform the surgery on me. I'm grateful that I'm trying to live a fairly healthy lifestyle, that I was able to recover, that I had the support from Providence, my family.
Providing comprehensive system of care, along with seeing that final outcome and seeing smile on the patient face, that is the most satisfactory thing.